Okay, so one of the causes of syncope is something called autonomic dysfunction. Basically, in syncope, what you have is that for some reason the blood isn't getting to the brain. Because the brain goes without blood, you collapse. Uh, from a heart perspective, the heart regulates the amount of blood we're pumping out, and therefore, one of the things that can affect the blood getting to the brain is our heart rate. And similarly, our blood pressure, because you have to generate a certain amount of pressure to get the blood to the brain. And these are autonomic functions. So, one of the things you can do is you can test the response of the heart rate and the blood pressure. You can test how well they're working. And one way you can do this is by this thing called a tilt table test. And in the tilt table test, what happens is you lie the patient flat, you measure their heart rate and their blood pressure, and then you tilt them up in different positions. And what you're trying to do is you're provoking things. So you're trying to provoke an abnormality to see if there is an abnormality. So what will happen normally is the minute you start bringing gravity into the equation, gravity pulls all our blood down to our legs. So our heart has to respond in some way to try and increase the amount of blood to the brain. If it fails to do that, then that would be a mechanism for syncope. So tilt table testing can be extremely useful because you observe the normal responses and see whether they match up to what you expect or whether they don't function as well. And that can then be very useful in making a diagnosis. They don't. They do it gradually, but they can leave you in certain positions for a prolonged period of time. So they will tilt you 30 degrees, and then eventually they're trying to tilt you vertically. And then sometimes what they can do is, even if you may not necessarily, if your body is behaving fine, sometimes they can try and aggravate things by giving you a spray called nitrolingual spray to open up all your blood vessels to again see how you respond. Does your body cope with that? And if it does, then it's a very good thing. And if anything is going to show up, it's going to show up during that provocation. Absolutely, because now you're standing up, so gravity is pulling all your blood down, and someone's opening up all the blood vessels, so there's more room for the blood to go down. So now we are really beginning to test the integrity of your reflexes, your heart rate reflexes, to see whether they can compensate for that. I think, the biggest benefit is it helps make a diagnosis if indeed your big problem is your blood pressure, for example, that your blood pressure is falling and that's why it's on. There are lots of benefits to this. It is always a good idea to know what the diagnosis is. Why? One of the big problems with syncope is, particularly unexplained syncope, is that from a driving perspective, it can be considered very dangerous. If you're sort of blacking out without knowing why you're blacking out, then the DVLA, the driving regulatory authorities, take a very dim view of that, because not only are you going to endanger yourself, but you could endanger someone else. So when a person has syncope, and if it's unexplained, then they sometimes stop you driving, up to a year. So making a diagnosis allows you, A, to have a label, and B, depending on what the cause is, you can potentially get your license back. Now, in tilt table testing, what they're looking for is something called reflex vasovagal syncope. And that what happens is the blood pressure tends to fall as we are put upright. And when the blood pressure falls, often what happens is the blood slowly drains out of your brain. So you get a warning. And that's really important, because if you can demonstrate to the DVLA that actually I get a warning, and therefore I have time to stop and recover, then that's something that they are sympathetic to. The second thing is, if you make that diagnosis, then you can treat it, because if it's a case of the blood pressure falling, then increasing the amount of water we're drinking, having more salt in our diet, medications that improve our blood pressure, all work really well. So yes, it's a bit like a bitter pill, but the outcome is that you can potentially not only get your life back, you've made your diagnosis, but you can also get the right treatment for it. So, when you go to have the tilt table test, you really want for that tilt table test to show. So yes, if you get syncopal, the problem is it'll make you feel awful, but you'll recover. They tilt you back down, the blood starts getting to the brain, and you feel better.